Picture this. You're walking down the street and the sweet elderly lady in front of you suddenly collapses. Would you be able to help her? Or do you watch helplessly until help arrives? I'll be discussing the importance of being trained in CPR so that you can be prepared to be the one that helps. Just because you are not a licensed medical professional does not mean that you cannot perform CPR. According to the American Heart Association, 450,000 people die each year from cardiac arrest. In addition, 350,000 cases of cardiac arrest occur outside of a hospital setting. These out-of-hospital settings can be a patient's home, any public place, or even a nursing home. One example of how important CPR skills are was found on the Red Cross website. It was a story of a 4-year-old boy named Miles who was swimming and in a hot tub with his dad, but in a flash was in the adult pool and was unable to swim. His dad and a friend pulled Miles out of the pool unresponsive. They tried to do CPR, but were untrained and in turn unsuccessful in reviving Miles. Luckily, 2 trained teenage lifeguards were standing nearby who skillfully and successfully were able to perform effective CPR, which saved Miles' life. According to data retrieved from the American Heart Association in 2014, almost 45% of all out-of-hospital cardiac arrest victims survived when a bystander was able to perform CPR. Now that we've discussed how a bystander can be a lifesaver, let's discuss exactly what is cardiac arrest and what are the steps required to perform adequate CPR. Cardiac arrest happens when the heart's electrical system malfunctions. It causes an irregular heartbeat or an arrhythmia. While the pumping action of the heart is disrupted, it cannot effectively pump blood to the brain, lungs, and other organs vital to survival. Immediate CPR, along with the use of an AED or defibrillator, can greatly increase survival odds. Now let's discuss the steps that should be used to effectively do cardiopulmonary resuscitation or CPR. The first step in effective CPR is you want to make sure the person is safe as well as the scene. So make sure those are both safe, then you can move on. You shake the person's shoulders. You're going to shout at them, "Are you okay?" If you do not receive a response back from them when they're being shaken, you need to listen and look for breath sounds. So in order to listen for breath sounds, you put your ear right up to the mouth and listen if any air is being taken in. Also, you can look at the chest for rise and fall and check breathing that way. Once no response is given and no breathing is found, you can move on to CPR. You're going to put both hands over the chest like this, overlapping the hands, and you're going to use your body weight to compress the chest at a depth of at least 2 inches and at a rate of 100 per minute. For every 30 compressions that you give, you should stop and give 2 rescue breaths. You want to make sure you're giving effective rescue breaths, so you want to do, you're going to tilt the head back and tilt the chin, and when you give a rescue breath, you should be able to see the patient's chest rise and fall that way. You continue to do this until help arrives or someone has an AED. My hope is that you now understand how important it is that everyone becomes skilled in CPR. I encourage you to join a class, either in person or online. You can go through the American Heart Association or Red Cross, and that's just to name a couple. They're readily available everywhere. So you could be the difference between life and death. So I highly encourage you to do that and be able to save someone's life. Thank you.